Hi, and welcome back to the Mom and Mind podcast. I am your host, Dr. Kat, and this is another episode of Behind the Sessions. Today, I want to talk with you about how to even recognize perinatal mental health symptoms within yourself. I think this is so important because a lot of people, a lot of us, don't realize that we're dealing with the perinatal mental health condition sometimes for quite a while. And sometimes, if you developed some years ago when we didn't have as much language or as much information about perinatal mental health conditions, or even now, some people go years without knowing what is going on with them. And it is real. It's very real. Perinatal mental health conditions can affect anybody through the reproductive period of time. This is conception, IVF, miscarriage, loss, pregnancy, birth, postpartum, and sometimes for years after. And I think that we just don't get enough information about what to look for within ourselves. We hear terms like postpartum depression. We hear things like baby blues. And if you're not really sure what you're looking for or don't know what to notice, then those terms kind of just float out there. Like it could, oh yeah, that there's that thing that can happen, but then what? So how do you know if something like that is happening to you? And there are people for sure who have some awareness and knowledge of mental health and symptoms, or would be able to recognize that maybe they're experiencing something again that they had experienced previously, like depression or anxiety. A lot of us don't know. And if you know my story at all, you know that I, even as a psychologist, did not know that I was experiencing perinatal mental health conditions. And that's because I wasn't really taught what to look out for, what to notice, and what the symptoms really were and are. So a lot of people come into therapy also not fully realizing, even if they've been told that they might be dealing with some kind of perinatal mental health condition, you still don't necessarily, or they still don't necessarily know all of the parts of their experience that are or can be related to perinatal mental health. The nature of these conditions, the nature of depression and anxiety, bipolar, PTSD, psychosis, is that they change how we think. They change how we perceive things. And psychosis and a bipolar disorder has some additional ways in which your reality is shifted and changed. But I'm in this moment anyways talking about the ways in which, and depression makes you just feel bad about yourself. You don't necessarily think, oh, I'm depressed. That's why I feel bad about myself. So I want to give at least some information, some context, some things to look out for so that if you are experiencing something, you would be able to potentially pick up on it. Now, a big caveat here is that I can't possibly list all of the ways that people experience a perinatal mental health condition because some of what you experience is contextual, like it is taking place within the context of your life. So your symptoms might have a different shade of this or have a different flavor of that and aren't necessarily going to be, none of this really is cookie cutter, but there are a lot of similarities that a lot of people experience. And so if I can just drop some hints for you today that you can notice within yourself, then great. Also, bonus, if you notice these symptoms in somebody else, maybe it's not you that's dealing with it, or maybe you are, and you're noticing these symptoms in somebody else, you might be able to be that helpful person, or at least give them a nudge and help them know that they're not alone and that they can get help for what they're experiencing as well. Additionally, understanding what you're experiencing takes, and knowing that it's a thing, it's a diagnosis, or it's something that other people experience, it takes some of the shame away, some of the maybe embarrassment, some of the secrecy that you might have or might feel like you need to keep around how you're feeling. As I say over and over, stigma and shame just create silence, that it is silencing to feel that stigma and shame. And the more silent we are, the more internal we are with our experience, the less likely we are to reach out for help, get support from other people, get the help that we need. And that stuff just stays in and manifests and grows in really negative ways if we don't get the help and if we don't come out of the shadow of shame and stigma. Staying silent is something that a lot of people feel like they have to do, or at least they don't know how to say how they're feeling or express it or explain it. So some of the ways I'm going to talk about it are inherent in there, are ways that you can understand what's going on for yourself and maybe talk about it with other people. I and other people who've been on this podcast have talked about how long we went without sharing anything with anybody and how much pressure there is to like keep the mask on that I'm fine and everything's fine. And that's shame and stigma right there. And it's also lack of information, a lack of education, a lack of really knowing what to look out for. So I'm going to break down a couple of things. The term baby blues is used fairly frequently, and sometimes it's interchanged with postpartum depression or other perinatal mental health conditions. But I want it to be clear that these are two different things. Baby blues are something that like nearly 80% of people experience in the first couple of weeks after birth. This is some mood changes, some tearfulness potentially. Obviously, there's a lot has happened and there might be some mood changes, but you're more or less with the right kind of support and help and sleep, nutrition, all of those things, the baby blues will dissipate and go away. Not to say that there wouldn't be some like lingering symptoms or still have fatigue or anything like that. But those first couple of weeks after birth, a lot of people are experiencing these changes. However, if during that time, those first couple of weeks, what you're experiencing is more than just mild and lasts more than 2 weeks, we're talking intensity of symptoms, duration of symptoms, then we're looking at something more along the lines of a perinatal mental health condition. So I'm going to go through some of this with you. Again, right now I'm mostly talking about postpartum. So first we'll start off with baby blues we talked about. Now, postpartum depression, again, the symptoms are more intense and the duration is longer than 2 weeks. So if you're feeling sadness, loss of interest in things, changes in your appetite, your sleep, that could be eating more or less, sleeping more or less, really low energy, feeling really bad about yourself, like feeling like a failure, feeling like you have like brain fogginess, difficulty concentrating, difficulty with memory, and certainly the symptom of feeling like you'd be better off dead or having thoughts of suicide. That is a very severe symptom of postpartum depression and should be attended to immediately. Here's where it gets difficult with all of these symptoms that I'm going to talk about is that if you just had a baby, you're going to be tired. Your sleep patterns have changed. Your eating patterns have changed. You are going to have foggy headedness. You are going to have difficulty with concentrating. And so it can be a little hard to tease out, okay, what is just part of this transition and what is a perinatal mental health condition. And that's partly why understanding the intensity of symptoms and the duration of symptoms is a key part in understanding if you're dealing with something like a perinatal mental health condition. So what the symptoms are and how it feels, some of it really overlaps. You can feel that sad tearfulness, but the things you say to yourself, it's not just that you feel bad about yourself. That is for sure in there, but it can be like feeling like a burden, feeling like you're not good at this, like your kid would be better off with a different parent, that life is too hard, that you can't do this. It's like an intensity of overwhelm. It can feel like physically very heavy, like your body can feel heavy. You could feel withdrawn. You could feel like not talking to people. You could feel disconnected or withdrawn from your baby, that symptom shows up in other things as well. And I should say, there are symptoms that overlap in with other conditions. But when we're looking at depression, that heavy sadness, loss of interest in doing things that you used to like to do, or loss of doing interest in anything like low motivation, those are some hallmark signs of depression. And as any of these conditions go on, but depression and anxiety and PTSD, and really all of them, there can be feelings of rage. So I'm not just talking about anger or feeling angry or irritable, although anger and irritability is a part of all of this and can be. This kind of like physiological intensity of anger can come with overstimulation. Can come with fatigue, like loss of sleep. It can come with being like overwhelmed, overburdened with things to do, things to take care of, not having enough support. There are a lot of things that can feed into the feelings of rage, but I think it's important to note that rage is and can be a part of a lot of things. So if you're feeling that really intense anger, then that is something to take note of and consider that you might be dealing with a perinatal mental health condition. Moving on to anxiety. We talk about anxiety as like, yeah, I'm anxious or I feel anxious, just as in like colloquially, or we're talking about a temporary mood. But the same with depression. But when we're talking about clinical diagnosis, again, this is intensity and duration. So with anxiety, you can have excessive worry that feels difficult to manage or can feel out of control in a way that the worry is just overwhelming. And the worry can be related to a lot of different things. It can be focused on a handful of things, but a lot of the worry is about baby or yourself. And there are other ways that anxiety can manifest that I'll get into in a little bit. But you could have thoughts that feel like your thoughts are kind of spinning. You could have difficulty concentrating. Anxiety also has a lot of physical symptoms. You could feel like fluttering of the heart. You could feel a rapid breath, a shallowness of breath. You could feel tingling in your hands. Sometimes people can feel lightheaded. Basically, like with anxiety, your body's in a fight or flight type of a space a lot of the time. So your body is responding to potentially a lot of things in your environment as if you need to be like ready for something because you're scanning the environment. You might be hypervigilant and looking for a lot of things in your environment to watch out for. It could be related to baby again or other things. But with anxiety, it can manifest in ways where you feel like you need to control a lot of things and manage a lot of things because that's how you kind of keep your anxiety in check. Like the things you're worried about. Maybe you don't want somebody else to hold the baby because you're worried about germs. And I'm going to differentiate this between anxiety and OCD in just a moment. But there is, again, this like general worry that is just there and present. I want to say something about intrusive thoughts. Now, intrusive thoughts are these worry thoughts or bothersome thoughts that pop into your head about something bad happening. It can be related to like a situation that you're in, or it can come out of the blue. Some common ones are like worry that you're going to drop the baby or something like that. Intrusive thoughts can happen and do happen to loads and loads of people, whether you are having a diagnosable mental health condition or not. It's just in some ways part of our brain function. You have random thoughts. But when you have anxiety and you have a new baby and you have an intrusive thought, the stakes are sort of higher, if you will. The thought that you're having, if you're already hypervigilant and you have a thought like, oh my gosh, what if I drop the baby? It's not just some like random thought about some random thing happening. It's that you are there taking care of this baby, and the idea that there's something you could do that could harm the baby or some accident that could happen that could harm the baby. You're in the middle of trying to figure out how to just be a parent and take care of this new baby. And when those intrusive thoughts come in, they feel more intense because you're in a vulnerable state. You're probably tired, exhausted, where potentially maybe in the past you had some random thought, you could bat it away. Now it's a bit harder to do that because of this vulnerability and because the stakes maybe feel higher. Or because you're dealing with a perinatal mental health condition, and just by nature of that, it's harder to manage the thoughts for a lot of the reasons that I mentioned. What I think is really important to note about all of these conditions, most of them anyways, is that you can outwardly look quote unquote normal. It doesn't necessarily, like, having a mental health condition doesn't mean you look disheveled, or that you have like dark circles under your eyes all the time, or that you like never comb your hair. These are really like outdated and sort of passe ideas of what mental health looks like in people. Mental health conditions looks like me. It looks like the person on the street. It looks like, your best friend. It doesn't have a specific look. Now, definitely there are ways in which you can look depressed, you can look anxious, you can be not taking care of your physical self. Those things are there, but it doesn't always mean that. And so sometimes you'll go to a doctor, go to a friend or whatever, somebody, and if I've heard this so many times that a client will go or a patient will go and talk to their doctor about how they're feeling. And they'll say to the doctor, I feel depressed, or I feel anxious, or something doesn't feel right. And the doctor or provider, whoever it is, will say, well, like, you look fine, so you must be fine. And we have to really break that up and break that down, and stop using that as a barometer for how people really are. Because if you're only using that measurement to decide how somebody is doing, well, then we're missing a lot of people. We're really overlooking that there's so many people that are dealing with mental health conditions. And in this day and age, it's stressful. Life is stressful. So even if you don't have a diagnosable mental health condition, let's say you don't meet all the criteria, doesn't mean that you're not dealing with stress. And that's also true in this perinatal period. Even if you don't have a full diagnosis, it doesn't mean that, like, what you're experiencing, if you do have distress or stress, that still could mean that you're suffering to some extent. So we can't just decide that, oh, because people look a certain way or are acting a certain way, that means they're fine. We have to dig a little deeper. And that might mean you reflecting a little bit more too about yourself and how you're doing. We are very good at lying to ourselves or not wanting something to be bad or wrong or anything along those lines. So sometimes we have to take a deep reflection of how we're really doing to be honest with ourselves. So just of note as we're going through this. And certainly if you come across anybody, since we're talking about perinatal mental health, if you come across anybody who's in this process of trying to have children and having children, just keep it in mind. How people look doesn't always reflect how they feel. All right, so shifting over to postpartum OCD. OCD is obsessive compulsive disorder. So it's hallmarked by having obsessive thoughts, obsessive worries, and compulsive actions or behaviors or compulsive thought processes. So these are like repeated things, and they can be hyper focused. The classic example is like washing your hands a lot, about washing your hands to the extent that your hands become raw, or that you have to wash them a certain amount of time or a certain number of times before you do anything else. Or after every single time you touch food, you have to wash your hands, or you touch anything, you have to wash your hands. And again, it's not just washing hands, but this is the example I'm using. Whatever your obsession is and compulsion is, it's something that is happening frequently enough to impact your functioning and get in the way, even potentially delay you like moving through your day. And postpartum OCD worries can be focused on many different things. It can be focused on health. You worry about illness, worry about contamination like germs and that kind of stuff, worry about harm coming to the baby or to yourself. It can manifest in like checking behaviors, like needing to check that the door is locked a certain number of times. And even with reassurance, like knowing that, okay, yeah, I see the door locked, and you walk away and then you're double take, triple take, you're not totally sure, even though you just checked. There's a part of OCD that where a lot of reassurance and reassurance seeking can be a part of that pattern where you're just not, it's almost like you can't trust that things are going to be okay. So there's a repeated pattern in checking. And there can also be unwanted sexual thoughts. This is very difficult part of OCD, but it can be unwanted sexual thoughts about something happening to baby, something happening to you. And these are really intense. OCD is really hallmarked by an intensity of experience. And the thoughts and feelings can be like debilitating at times, can be really hard to focus. You can have feelings of guilt after having these thoughts and compulsions. You can definitely not want to be having any of these thoughts or any of these behaviors. And it can feel hard to stop or nearly impossible to stop and get out of that loop. And sometimes this can, for some folks that I've met with, it has manifested in like not being able or wanting to drive anywhere, or certainly drive anywhere with the baby because of these intrusive thoughts or fears of what's going to happen. And it can be debilitating to the point where like people don't leave the house because they're worried about what will happen out there. And there may be other ways, like I had mentioned before, like maybe somebody's worried with anxiety, worried about somebody else holding the baby, and if they have germs or don't want to get the baby sick. I mean, there's some, that doesn't necessarily mean anxiety if you don't want your baby to get sick. Like that's a pretty normal thing to not want your baby to get sick. But if the anxiety feels like overwhelming, difficult to manage, then that's a marker. Moving on to PTSD, some of the symptoms of PTSD are if there was an actual or perceived threat to the self, meaning like birth trauma is a common one where something happened to you that was traumatizing. PTSD can manifest from things that maybe other people didn't see or notice, but was threatening to you or threatened your safety, threatened your security. So what happens after PTSD is you can feel avoidant of certain places or things where the trauma happened. You could have flashbacks of parts of the experience. You could be missing whole chunks of memory from the experience. You could have nightmares. You could have hyperarousal, like feel on edge, feel jumpy, again, feel irritable. There could be helplessness. But you can feel fear. You can feel that sadness. You can feel isolation. You can feel like numbness. You could feel like things are sort of distant, like the world is happening and you're watching it happen rather than like being a part of it. So that's like kind of feeling distant or detached. You can feel overstimulated, like there's a lot that you're trying to manage especially if you're hypervigilant in your environment. You could startle easily. You could feel anger, you could feel rage, and you can feel a lot of the things that are in depression and in anxiety within PTSD. However, there's often something that kind of sparked or started the PTSD, the traumatizing situation or the event that happened. Again, it could be something that other people saw or witnessed, or it could be something that you just experienced internally. As they say, trauma is in the eye of the beholder. So nobody else gets to decide if something was traumatizing for you. That's for you to determine. Moving on to bipolar disorder. The symptoms of a bipolar disorder. I do want to say I hear the term bipolar being thrown around way too casually in many instances. And people use the term like, oh, you're being bipolar in this way to say like you're having some mood changes or you're going between like two different opinions about things. But that is not what it means. And bipolar disorder is a debilitating condition. And for people who are experiencing bipolar disorder, they're either having like a full deep depression or they're experiencing mania or hypomania. And these are not just like little mood swings, like one day you feel this way, one day you feel the other. These are very big changes in mood and the depression can last a while. Mania, hypomania can last a while. Or for some people, there's like a quick cycling through depression and anxiety, relatively quick. But it's marked by mood swings, impulsivity, had dangerous behaviors, risky behaviors. For mania in particular, people don't sleep and don't need sleep. Like their energy is really high. They can be euphoric. For people who are experiencing hypomania, they could be having like 4 hours or less a night and still, again, be fine. You could experience like the pressure to, like an internal pressure to do a lot of things. You might have a lot of ideas, big ideas, things that you want to accomplish all of the sudden. You could be feeling like super great about yourself, like having this really huge sense of confidence that's outside of your norm. And when things get really intense with mania and hypomania, it becomes like an intensified version of something that's already intensified, like racing thoughts. Sometimes it's very fast speech. Sometimes people will like have behaviors where they can't stop. Like one woman described having hypographia, like she just had to keep writing. Other people will experience spending like excessive amounts of money, money that they don't have, or money that they do have, but they're just spending it excessively on big purchases, things that they wouldn't normally be purchasing. And so this can all come, again, maybe needless to say, but with like poor decision making or altered decision making that results in risky behaviors. And what can be really hard about a bipolar disorder is that for sometimes people who are in a manic or hypomanic state, it feels great, at least until it burns out, until it gets to a point where they are potentially like in danger to themselves, harming themselves. That like really high feeling can feel great. It can be really hard to recognize it within yourself if you don't already know that you have a bipolar disorder. The symptoms of bipolar disorder can become very intense, and it can be hard if you, like, let's say you're somebody who is noticing this in somebody that you love. It can be really hard to convince them to get help or get support. And certainly with a bipolar disorder, same with depression, there can be suicidal thoughts that come with the depression. So it's a very intense mental health condition that needs to be taken seriously. It's not throwing around this language of being bipolar when you're just talking about, hey, you have this mood difference from one day to the next, is really not it. So, I want to talk about postpartum psychosis. And for some people who have an undiagnosed bipolar disorder or diagnosed bipolar disorder, they can develop also postpartum psychosis. You don't have to have that to develop a postpartum psychosis, but that can happen. So, when we start talking about things like psychosis, people don't know what to do with that. And in terms of mental health and the stigma, I think there's the most stigma about postpartum psychosis because it is misunderstood. It has been mischaracterized in the media and in a lot of places. And again, we have these ideas of what mental health disorders look like and what psychosis looks like. But what it looks like and what somebody's experiencing and like what you would be looking out for aren't always the same thing. How mental health conditions have been characterized in the past and maybe not too distant past is again of this like disheveled, unkempt, sort of quote unquote, and I hate the word, crazy person. And we've done a disservice to people who are really suffering by minimizing mental health into these tiny little boxes. There are people that you know and love who have experienced any number of the things I'm talking about today. And it might have been you who've experienced this and somebody that you love. Postpartum psychosis needs to be taken very seriously. It is a medical emergency. And in many cases, a postpartum psychosis onset can be within the first couple of weeks postpartum, but that is not always the case. anytime within the first year. And that's true for all of these conditions. Anytime within the first year postpartum, there can be an onset of symptoms. But what we're looking for in postpartum psychosis can sometimes be a little bit harder to notice unless there are really outright symptoms of hallucinations, delusions, paranoia, confusion, like a state of confusion, not having sleep or very poor sleep, and not just difficulty concentrating, but like difficulty being present and tracking time could be part of it. Sometimes the onset of a psychosis in the first couple days, a handful of days, somebody can be experiencing a lot of these intense symptoms. But for other people, there can still be a quickish onset, but their symptoms could be waxing and waning, meaning like sometimes they could appear and feel sort of fine or how you know them to be. And then other times could appear sort of preoccupied, internally preoccupied or distant. They could be saying things that don't make sense or that you don't understand. But in terms of what they're feeling and experiencing, and again, I'm not going to be able to state everything that somebody with postpartum psychosis is experiencing, but it can be really scary for them to be feeling like things feel unreal, or they're having paranoia, or they're having delusions that something is happening or something is going to happen to them or their baby. If they're having difficulty tracking time and not being able to remember chunks of their day, that is very distressing. They could have like feelings of disorientation, not being able to track time, but time and place. And they could have disorganized speech or erratic behavior. And when a psychosis has really taken hold, the person who's experiencing it is not experiencing reality in the same way that they would be if they weren't having psychosis, or in the same way that you might be if you're not experiencing psychosis. It's an altered state, and one that really needs to be attended to as soon as possible. Because when somebody is in an altered state, when they're out of touch with themselves, with how they normally feel, not only are they afraid, but they might not be able to express to you, they might not be able to tell you what's going on anymore. They could be experiencing distrust, but at that point, there is not necessarily an awareness that they're in a psychotic process if it's at that intensity of symptoms. Again, I want to be very careful with all of these conditions and walking through them. I'm not saying every single possibility that can happen, and I'm certainly not speaking to every single person's experience of how this manifests and how it feels for them. But there needs to be just at least enough out there that if you experience any of this yourself, or anybody who's experiencing any of this, that, hey, you can be tipped off to this might be one of those things, and you could need more support, or that person you care about could need more support. So what to do if you are recognizing these symptoms? And I went through quite a few, but again, not all of them. But it is so helpful to just acknowledge it. Like I said before in the beginning, like trying to be honest with yourself about how you're really doing, and know that it's not your fault. You didn't do anything wrong. You didn't do anything to cause this or create this. These things happen, and they happen to people at every level of socioeconomic status, every color, every shape, everything across the board. And then if there's somebody that you can speak to, even if it's just one person that you know will take time to listen and not be judgmental, or just sit with you while you're talking through how you feel, reach out to that person. Could be a friend, could be a partner, could be a therapist, could be a doctor, could be somebody in your community, just somebody to start you on the process to talking through this, getting some support, and trying to figure out what your next steps might be. And those next steps can be small self-care steps, negotiating with your partner or a family member on getting more sleep, figuring out ways with yourself or the people around you on how you can eat more regularly, drink enough water, And those kinds of like basic care needs are really important, more important than you would know. Sleep, nutrition, fluids are key in just having your bases covered. Maybe you've been stuck inside the house for days. Maybe just like stepping outside, opening a window, getting fresh air, using some breathing exercises that you've learned. Maybe you took a yoga class once and you learned how to do some diaphragmatic breathing or some deep breathing, or going on a walk. The small self-care steps don't need to be groundbreaking and shouldn't be. You don't want to overwhelm yourself by putting too much on your plate, so much on your plate that you can't accomplish that. And then you feel bad about that too. Small, manageable self-care, even if every day when you wake up, you just ask yourself, what's one thing I can do for myself today? And if that's all that you can muster, then cool. And then, of course, seeking professional help. Whether you have a diagnosis or not, you don't need a diagnosis to get help and support. You don't have to have any one of these conditions in order to reach out to a friend, in order to go to a therapist. You could have significant stress, even if it's not a fully diagnosable mental health condition. You can get therapy. Certainly, if you do, or if you're concerned about it, go to somebody who has training, who is perinatal mental health certified, or who has training in perinatal mental health. They can help you figure out what's going on and figure out if the intensity of your symptoms are at a point where medication should be considered as an option. You can also look into support groups. I talk about Postpartum Support International all the time, but they have free online support groups there and a therapist directory. So cost doesn't need to be a barrier there. You can get support for free. And what I really want to drive home is that all of these are treatable. People get better when they get the right kind of help, when they get the right kind of support. You can get back to being yourself or your new self or whatever it is, however it is that you want to be. You can with the right help. But if we keep it inside, if we decide that we don't want to share this with anybody for fear of judgment, or which are real things that people consider. But my point is, if you keep it inside, if you don't get help, if you keep blaming yourself, it's just so oppressive and suppressive. But just being honest with yourself, if you can be, reaching out for that little bit of support, adding in a little bit of self-care that is manageable, and then just knowing that you're not alone. Even if you do feel like quite alone and lonely in your experience and in your life, there are others of us who have gone through this, who can identify with you, who, even if we don't have your exact experience, we know, we get it to a certain degree. So you're not alone in the fact that you're not the only person who's gone through this, and you certainly don't have to figure out how to get out of it by yourself. So that's my overview for today. If you have any other symptoms that for you, for sure, were a big part of your experience that I didn't list, I would love for you to leave a comment on the YouTube videos or in the podcast platform that you listen in on. You're always welcome to send me an email, drkat@Mom and Mind. And for sure, if you know of anyone who could be struggling, or if this resonated with you and you want to share it, please do. This information doesn't need to be kept behind a paywall. It doesn't need to be kept from people. Share it so that everybody knows what this looks like and everybody can identify it with themselves or somebody that they love and care about. And absolutely, if you feel like any of this resonated for you and you need support, reach out, go to postpartum.net and find some support so that you can get back to yourself. I thank you so much for being here with me. Until next time.